Hi, everyone. I'm Dr. Gauri Apte, and today we're going to talk about the COVID-19 vaccine. Now, I want to start by acknowledging that it's not unreasonable to be apprehensive about taking this vaccine or to be skeptical about the authorization process, considering how quick it was. But what I want us to understand is that even though this vaccine was approved at record speed, it does not mean that any steps were skipped. So, for all of the approved vaccines, whether it's the Pfizer BioNTech vaccine, the Moderna vaccine, or the Oxford AstraZeneca vaccine, all of these vaccines went through phases 1, 2, and 3 of clinical trials, during which their efficacy was studied, any side effects were noted, and only when the vaccines were successful in each of these phases were they deemed as effective and then approved for use during an emergency, such as the pandemic that we're in currently. Now, there might be people that are concerned about the long term side effects of this vaccine because it's just so new. And while that might be true, what we have to understand is whenever we take any medications or vaccinations, we have to weigh the risks versus the benefits. The risk here is that you could get infected with COVID, you could develop a severe illness, or even die from it. On the other hand, the benefit of the vaccine is that the vaccine is highly effective with minimal side effects such as injection site soreness, muscle aches, or fever. So, in this case, the benefits highly and greatly outweigh the risks. The second question that we get commonly asked is I'm a young, healthy individual, I'm relatively low risk for COVID, why should I take the vaccine? Now, while it may be true that young, seemingly healthy individuals are more likely to develop a milder illness or be asymptomatic, we are seeing many cases of young patients who go on to develop serious complications or even die from COVID. Even for those that may have had a mild illness, we're seeing more and more evidence of lung scarring, of sensory neural deficits, or becoming what's known as long haulers, where you're seeing symptoms months after initial infection. The truth is that we simply cannot predict who amongst us is going to go on to get a severe illness and who is going to just not have any symptoms from this disease or have a mild illness. So the best thing we can do is to protect ourselves by getting vaccinated. The other reason why it is important for healthy individuals to get vaccinated is for what we call herd immunity. Herd immunity is when a sufficient proportion of the population becomes immune to a certain disease in a way that it stops further community spread of that disease. Why this is important is because this herd immunity protects those sections of the society who cannot take the vaccine, such as patients that are severely immune compromised, patients undergoing cancer treatment, newborn babies, or children born with a deficient immune system. So, when healthy individuals take this vaccine, not only are we protecting us from what could be a deadly illness, but we're also protecting the more vulnerable sections of the population. I hope all of this information at least encourages you to discuss this vaccine with your doctors. We've been in this pandemic for almost a year now. We have a vaccine that is highly effective and it's safe and can protect us. So let's all get vaccinated so we can move a step closer towards regaining normalcy. If you have any questions or comments, please leave them in the comment section below. You can also email us at info@fertilihealth.com. Thank you for watching and stay safe.